I helped start this because we have some very concrete needs that are not being met right now as far as taking care of patients and ensuring that workers are not infected. We have a lot of issues with getting the gear that we need to protect ourselves. We also have issues with getting the equipment we need to properly take care of the patients. And we're out here today, not just to draw awareness to that, but we have some very concrete demands that we would like to have met by the public healthcare system here.
Can you, for a national audience, even for people in New York City, Health and Hospitals Corporation, understand the difference between city hospitals and the private hospitals, and is there different treatment within? You're standing outside of Harlem Hospital, which is a city hospital.
Yes.
So often understaffed, undersupported. And then if you could go to the issue of, the issue of problems even before COVID and the coronavirus.
Right. So I do work at a public hospital within the Health and Hospitals Corporation system. There's a private sector system that comprises other institutions. And there have always been funding disparities. You know, we rely on public funding that has been cut continuously over the past several decades. We're looking at some of those cuts now with the introduction of the Medicaid cuts in this most recent state budget. And really the crux of the issue here is that we're looking at a system of healthcare, not just in New York, but throughout the country, that prioritizes extracting a profit while making people feel better instead of actually participating in some kind of widespread healing effort. And this is what happens when you have people running this system that are not direct workers, when they're, absorbed with their bottom line, and the politicians who write the policy are, owned by them. And really the people that suffer are the people on the front line and the patients. And so that's why it's been really interesting to hear this idea of nationalizing the healthcare system come out of this, because right now we're dealing with the scarcity of resources and disjointed resources. And with the nationalized system, what we have is the ability to share resources across the system as needs arise.
Finally, Sarah, what gives you the strength? What gives you the remarkable bravery to go to work every day when you encounter your own pre-existing condition?
Right. So I'm type 1 diabetic since the age of 2. I'm now 30 years old. This is not a time for people to be sitting on the sidelines. We need to be out here in it. We need to absolutely have our voices heard. We need to make big demands of this system, that it be changed in a way that can make it so that in the future we're not cut to the bone in a situation like this, that we have a robust healthcare system. And that's what we're out here today to ask for.
You're supporting Medicare for all?
Yes, absolutely. Medicare for all. Even further measures such as nationalizing the healthcare system.
Well, I thank you so much, Sarah, for being there. Registered nurse working at MedSurg, that's Medical Surgical Unit at the City Hospital, the public hospital, Harlem Hospital. She's part of New York State Nurses Association Union, helped to organize today's frontline medical workers protest.